Hello, hello, Tashina Gonzalez here, and we want to welcome you already to episode 4 of our series with Healthy Pontiac We Can, ways you can support others in experiencing grief and loss. So this is a mental wellness webinar series sponsored by the Healthy Pontiac We Can Coalition. And just a little bit more on Healthy Pontiac. The Healthy Pontiac We Can Coalition promotes healthy lifestyles for people in Pontiac by aiming to improve health outcomes, increase accessibility and opportunities to be healthy in public spaces, and enhance mind, body, and spirit. And just a little bit on the leadership of Healthy Pontiac We Can Coalition. Our co-chairs, we have Lisa Braddix. We also have Elizabeth Crenshaw, Jennifer Lucarelli, and on staff, we have Jessica Williams. And you can see all the ways to contact Healthy Pontiac there at the bottom of the screen via Facebook, Twitter, on their website, their email, as well as the phone number. And we have lots and lots of partners that we want to thank for their continued support. We're not going to read all of these, obviously, but we do want to thank the many sponsors and active partners that we have supporting this initiative.
Tashina and I wanted to first off make it clear to you that we are not licensed mental health professionals. We do work in the field, and we know how important it is when a person is in crisis that they have available to them the information that they need to reach out and get the licensed providers that they need to aid them in their particular situations. So we did list some resources for you. All these resources will also be in the chat line, so you don't have to rush out and get pen and paper right now. You will have access to all of the resources at the end of this presentation. But we have the crisis text line available to you, the National Suicide Prevention Lifeline, chat line, Warmline to aid persons with mental health, as well as CNS healthcare. Additional resources, we have the crisis lines for Oakland, Wayne, and Macomb County. We also have the the Trevor Project listed for LGBTQI Youth, National Alliance on Mental Illness, as well as Honor Community Behavioral Health Helpline. And we also have some COVID-19 specific resources to share with you. The Substance Abuse and Mental Health Services Administration Helpline, the State of Michigan website for coronavirus information, as well as the World Health Organization's website, the website for the Oakland County Health Department, as well as the website for Oakland County Community Health Network. This is the time, some of you know who we are. We've been doing this is our 4th in the segment of 5, but just in case you're just catching us for the first time, we are your co-hosts. Ms. Tashina Gonzalez is my co-host. She is a health and wellness educator with Vid Activa Education Services. And my name is Melchiah Newman. I'm the team supervisor for CNS Healthcare's Anti-Stigma Program. Welcome, welcome, welcome.
And with that, we're going to get into our content. So how you can help someone who is grieving. The first step is to understand the grieving process. And I just absolutely love the quote here. It states, grief, for those of us who understand, no explanation is needed. For those of us who do not, no description is possible. So it just reiterates the individual nature of the grieving process. But if you spend at least a little time understanding some key points, it will help you be able to support other individuals in the unique and individual way that they need to be supported. So we've been stressing that over and over again, that there is no right or wrong way to grieve. For each individual is going to be very different. And there's some situations that it's going to be very difficult to even empathize with if you've never gone through it, if you've never had the loss of a child, if you've never had the loss of a parent. So remember to support people in the way that they need, because each individual is going to grieve in a different way. Also remember how turbulent grief is. We know that grief comes with lots of deep and turbulent, extreme emotions and behaviors. So you really have to be kind with other people. You really have to be understanding with them, knowing that sometimes if they say things that are hurtful or their behavior seems inappropriate, it's really coming from the pain of the grieving process. And this is something out of the norm of how they usually behave. So try to be understanding and kind, knowing that this is part of the grieving process. And just remember that there is no set timetable for grieving. For that individual, however long it takes them is normal for them. So you can never do any type of comparison when it comes to the grieving process.
Know what to say to someone who's grieving. You want to express your concern to them. Let them talk about their experience. People who are grieving may need to tell their story over and over and over again. So you need to be patient with that individual. Through repeating the story, a person is processing and accepting the situation. With each retelling, the grief lessens. So by listening patiently and compassionately, you're able to help the person you're reaching out to find healing. Ask how the person feels. The emotions of grief can change rapidly, just as Sheena shared. So don't assume that you know how a person feels at any given time. Remember, grief is intensely personal. No two people's experience is exactly the same. So don't claim to know what a person is feeling or compare your grief to theirs. It's so unfair when you do that, because you have no idea how grief is affecting that individual. And sometimes there's no words to put to it. And if you are injecting your experience into the moment, instead of listening and allowing that person to share what's going on with them, then you've taken the spotlight off of the person that you're trying to help and making it about you. And in this situation, I'm sorry to say, folks, it's not about you. Be genuine in your communications. Don't try to minimize the loss, provide simplistic solutions, or offer unsolicited advice. Sometimes when we come into situations and we want to help people, we have good intentions, but sometimes our intentions get in the way. We can come in with an S on our chest and a cape flapping in the wind. We're going to save the day, and you end up doing more damage than you do good. It's better to listen. If you don't hear anything else that we say today, listening is the key. Allowing that person to share what's in their heart, and you listen without judgment. And at times, be willing to sit in silence with the person. If they don't feel like talking, don't press them into it. The comfort you provide, just being in the moment with them, you can't put a price tag on that. Your company can be enough. If you can't think of anything to say, that's okay. Or if they say something and you're at a loss for words, it's okay to say, I am so sorry you're going through that. It's nothing I can say that's going to change the way you feel right now. But I'm so glad that you feel safe enough with me that you can be honest. You can be yourself. Offer your support. Do what you can. Do what you can. But if you can't do anything else, just be there with a shoulder that they can cry on.
And that gives us an amazing segue into how you can help someone who is grieving. And the best way is to offer practical assistance. And as Malkia just mentioned, the best way to know what practical assistance they need is to listen and to ask questions. Ask lots of questions. In past episodes, we talk about some things that can happen, like feeling exhausted or feeling outside of your routine. So ask this individual if there's things that you can do in order to help with those types of situations. There's a lot of people that get benefit from kind words, or as was also mentioned, if you're just touching them and you're there with them and you're letting them cry on your shoulder or holding them, if that's the type of person that they are and the support that they need. You can bring over a meal, you can send them a card to offer your support. Again, if they're experiencing where their daily routine is disrupted, ask if they need some help going to get groceries, a ride to the doctor. Just continue to listen more than you talk, ask lots of questions, and be ready to provide the support that they need.
And be prepared to provide ongoing support if you're able to do so. I've often heard it said by people who have gone through the death of a loved one or another traumatic experience that brought grief. And they say, you know, at the moment that it happens, people are there, they're bringing meals, they're helping out, there's phone calls, there's all kinds of support. And then all of a sudden the phone stops ringing and I don't hear from people. There's nobody there for me to talk to. The grief process, the length of the grief process is going to vary from person to person. But most of the time, it lasts longer than we think that it should. Some people could grieve for months or even years. Are you able to stand with that individual? Are you able to provide them support, even if it's been months down the road? If you can stay in touch with that person, Tashina mentioned some ways that you could do it, but do it in an ongoing basis. Sending cards, sending texts, sending emails, making phone calls, providing meals if that's something that would be beneficial to the individual. But the longer you can support them, the easier it will be for them to heal and go through the process that they have to go through in order to get to the other side of this grief. Don't make assumptions based on outward appearances. Some people, they don't show their emotions on the outside. You can't tell by looking what's going on the inside of an individual. And with that being said, you don't want to put pressure on people to keep up appearances. One of the things I noticed with this COVID-19 situation is that we become a lot less formal, so to speak. I watch TV and it's nothing to see newscasters doing their reports with no makeup on, hair pulled back in the ponytail or a bun. They haven't gotten haircuts. Now that things are opening up a bit, we're starting to polish up a little bit more, but it's set a different tone. People are starting to be more accepting of the real you. And I think that's one of those silver linings that have come out of this COVID-19 experience, that we don't have to keep up appearances, that it's okay for you to be in the moment, whatever that moment happens to be for you. What you see is what you get, and that's a good thing. Allow people to have that space. If they don't feel like, dressing up, don't make them feel bad if they haven't or if they don't. Be aware of the fact that the pain of bereavement might not ever heal. The pain of loss might not ever heal. People have to learn to accept a loss. But what happens, the intensity of that pain will lessen as time goes on. But if you lost a spouse, if you've lost a child, that person can't be replaced. You can get another husband, but you can't get another child. And the person that's grieving, they need to be able to feel down the road that it's okay to talk about that person that they've lost, to say their name, to talk about things that were special about that individual to them. And offer, last but not least, offer extra support on the special days, the anniversaries, the birthdays, the holidays. Those are the days when a person who has experienced a loss hit them the hardest. If you're able, go to that individual and ask them, is there something special we can do to commemorate your anniversary or the birthday or the situation? Is this something we can do? Can we light a candle? Can we come together and pray. Is it something I can do to help to lessen that loss?
And with that, we're going to move into how you can help someone who is grieving. So we've mentioned this in the past also, watch for warning signs of depression. And it bears repeating, we are not licensed in this area. And so if you know that someone experiences more than one of these for more than 2 weeks, you definitely should make sure that you have a discussion with them about depression and make sure that they seek the appropriate care that they need for that situation. So some of those things are difficulty with daily functions, anger, increase or decrease in eating, increase or decrease in sleep, neglecting personal hygiene, increased use of alcohol or drugs, increased anxiety, fear, feelings of hopelessness, sadness, guilt, fatigue, and the one major red flag, if it appears by itself, talking about dying or suicide. Please seek assistance. Help that person seek assistance from a licensed professional if that arises. And that is the information that we wanted to share with you. We are so excited to share with you our final episode in this segment, which will be Discovering the Hero in You. And I had a quote that came across my feed today that was just perfect with this. And it's from Brene Brown, and it says, when we deny our stories, they define us. When we own our stories, we get to write the ending. And that's what our next episode is going to be about. And of course, before we close out, we always want you to know how to contact us because we have plenty of additional resources to share with you. So this episode will be on my YouTube channel, Tashina Gonzalez. You just search my name and then you can subscribe. So if you haven't subscribed yet, please feel free to do that as I create content on all things holistic health as a certified holistic wellness coach. You can follow me when I do lives on a weekly basis on Instagram. I also have weekly educational events on my Facebook page that you can see there, or you can also feel free to email me at any time.
And if you'd like more information about the award-winning CNS Healthcare Anti-Stigma Program, of which I'm privileged to supervise, you can get more information either by phone 248-409-4227, or you can email us at antistigma@cnshealthcare.org, or you can go to our website, www.cnshealthcare.org, and just click on the anti-stigma tab, and it'll give you information on how to contact us, how to book a presentation, or to find out more information about the work that we do. Thank you again for having us. We are so excited. This series has been phenomenal. It was timely. I believe it was God speaking from the heavens saying there are so many people that need this information, and we are so happy that we were able to provide it for you. Have a good afternoon.
Thank you.
You so
Bye.
much. Bye.